welcome Dr. Bashir.
Thank you very much. Thanks for the invitation.
So we have with us today Dr. Riyaz Bashir, who is a professor of medicine at the Temple University. He presented the late-breaking clinical trial, Rescue Trial, that was published in JACC Interventions yesterday. So let's hear from you, Dr. Bashir. Tell us a little bit about the trial and what you saw.
Sure. Thank you, Poonam. The Rescue Trial was an investigational device exemption trial for a device called the Bashir Endovascular Catheter. It was a prospective multicenter trial looking at the safety and efficacy of Bashir Endovascular Catheter-Directed thrombolysis in patients with acute intermediate risk pulmonary embolism. And our primary endpoint was reduction in RV-LV ratio, which was reduced by 33%. Our key safety endpoint was major bleeding and adverse events, and we had 0.9% major bleeding and adverse events in the trial. Our key efficacy endpoint was pulmonary artery obstruction reduction at 48 hours after the treatment. So we noted a 35.9% reduction in pulmonary artery obstruction after 48 hours. The protocol we used in the trial was we gave 7 milligrams of TPA into each lung through the device, and 14 milligrams for bilateral PE and 7 milligrams for unilateral PE. The major finding, I think, of this study was that we were able to accomplish improvement in RV-LV ratio as well as reduction in pulmonary artery obstruction as much as systemic fibrinolytics, like 100 milligrams of TPA would do. And the safety was as good as anticoagulation alone. In the PIFIL trial, anticoagulation alone had a major bleeding rate of 2.4%. So we're really excited about the results of the study.
Very nice. That's quite a low dose of the drug that you gave there. So tell us a little bit about the Bashir catheter and how you developed this catheter.
Sure. For the audience, I am the co-inventor of the device, and I do have conflict of interest because of that. But, Poonam, as I was treating a lot of pulmonary embolism patients with catheter-based therapies, I realized that we were leaving a lot of residual pulmonary vascular obstruction in these patients after we would treat them with single lumen infusion catheters. And I realized that we were using devices that were meant for very small vessels and trying to treat a blood clot in a 30 millimeter vessel with a catheter that's made for 5 millimeter vessel. So what I did is developed a device that has a nitinol basket at its end. So once the basket is expanded, it can expand up to 45 millimeters in diameter. And each limb of the basket is an infusion catheter that is reinforced with nitinol. So once we expand the basket, these limbs embed themselves into the thrombus. And then we give a pulse spray of dilute TPA, and that TPA gets trapped within the thrombus and continues to work till the blood flow is restored, because TPA gets only metabolized in the liver. So that was the inspiration for the development of the device.
Great. Now this is a single arm study, so I would say that probably that would be the biggest limitation.
It is.
Now, what are the clinical implications? We saw the RV-LV ratio and things, but what are the clinical implications of the trial?
So Poonam, the clinical implications of this trial are, when we looked at the thrombolytic efficiency of 1 milligram of TPA in reducing pulmonary artery obstruction, we noted that compared to other single lumen infusion catheters, the thrombolytic efficiency through this device was doubled. So we can significantly reduce the TPA dose and still relieve the pulmonary artery obstruction. So that's the biggest implication.
And the bleeding was 0.9%, which is very low. Yes, yeah, wonderful. So what are the future plans based off this study?
So I think the technology has evolved and matured enough that we should do a randomized controlled trial against anticoagulation in patients with intermediate risk pulmonary embolism, and also in high risk pulmonary embolism do a randomized controlled trial against systemic fibrinolysis. So in my opinion, those would be the two best steps in this field of pulmonary embolism treatment.
Awesome. What are your two take-homes for our audience?
So the two take-homes for the audience is that the catheter-based therapy for pulmonary embolism has evolved, and we can significantly reduce pulmonary artery obstruction, recover the right ventricle, and do it very safely with minimal bleeding complications. So I hope that we will consider patients who have very significant pulmonary embolisms with RV dysfunction and elevated biomarkers, that they be considered for catheter-based therapies.
Awesome. And for the full details of the rescue trial, please check out JACC Interventions. It was published yesterday. Thank you very much.
Thank you. Thank you very much.